Hello everyone. The topic of discussion is from Neuroanatomy. The topic is thalamus. The thalamus is a part of diencephalon, and the diencephalon is the part of brain that lies between the cerebrum and the midbrain. Before going into the details of thalamus, we will first discuss about the diencephalon and its parts. The diencephalon is divided into two parts by a sulcus known as the hypothalamic sulcus. The hypothalamic sulcus is an S-shaped sulcus which extends from the interventricular foramen above to the cerebral aqueduct below. The interventricular foramen is the foramen that connects the lateral ventricle with the third ventricle, and the cerebral aqueduct is the cavity of the midbrain. So, with the help of the hypothalamic sulcus, the diencephalon is divided into two parts. One part lies above the hypothalamic sulcus and is known as the pars dorsalis. The part below the hypothalamic sulcus is known as the pars ventralis. The pars dorsalis is again divided into three parts. They are the thalamus, the metathalamus, and the epithalamus. The pars ventralis is divided into two parts. They are the hypothalamus and the subthalamus. In the diagram, you can see the hypothalamic sulcus, which is an S-shaped sulcus that extends from the interventricular foramen above to the cerebral aqueduct below. The part above the hypothalamic sulcus is the pars dorsalis, and the part below the hypothalamic sulcus is the pars ventralis. Now, we will discuss thalamus under the following headings. First, we will look at the external features of thalamus, then the internal structures. After that, we will discuss about the connections of thalamus. This will be described under two headings: the connections of each nuclear groups of thalamus as well as the thalamic radiations. Finally, we will look at the arterial supply of thalamus and the clinical anatomy. The external features of thalamus. The thalamus is located just lateral to the third ventricle, or we can say that the thalamus forms the lateral wall of third ventricle. So in the midline you have the cavity of the third ventricle, and on either side we have the thalamus. The thalamus have two ends, the anterior end or the anterior pole, and the posterior end and the posterior pole. It also has four surfaces: a superior surface, an inferior surface, a medial surface, and the lateral surface. Coming to the ends or poles of thalamus. As we have mentioned before, the thalamus have an anterior end as well as a posterior end. The anterior end forms the posterior border of the interventricular foramen, whereas the posterior end is expanded and is also known as the pulvinar. So in the diagram, we can see that the thalamus have an anterior end here and an expanded posterior pole or the posterior end. The posterior pole or the posterior end is in close relation with two structures. They are the medial geniculate body and the lateral geniculate body. Coming to the surfaces of thalamus. First is the superior surface. The superior surface is related above and lateral to the body of the caudate nucleus. In the diagram, we can see the thalamus, and above and lateral to the thalamus is the body of caudate nucleus. Between the thalamus and the caudate nucleus, we have the thalamocaudate group. The thalamocaudate group contains two structures. Medially, we have the thalamostriate vein, and laterally, we have the stria terminalis. The thalamostriate vein drains the thalamus as well as the corpus striatum. The stria terminalis is a fine bundle of white matter formed by the efferent fibers from the amygdala. The inferior surface. The inferior surface is related to the hypothalamic sulcus, and below the hypothalamic sulcus, we have the hypothalamus as well as the subthalamus. The medial surface of thalamus forms the lateral wall of third ventricle, and the medial surface of the two thalami are connected by a mass of grey matter known as the interthalamic adhesion. The lateral surface. The lateral surface of thalamus is related to the internal capsule as well as the lentiform nucleus. The lateral surface of thalamus is separated from the internal capsule by a layer of white matter known as the external medullary lamina. In the figure, we can see the thalamus, the body of the caudate nucleus. Lateral to the thalamus is the internal capsule and the lentiform nucleus. The thalamus and the internal capsule are separated by a thin layer of white matter which is known as the external medullary lamina. Coming to the internal structure of thalamus. The internal structure of thalamus can be explained under two headings: the grey matter and the white matter. The white matter of thalamus. The white matter of thalamus mainly consists of three structures. They are the stratum zonale, the external medullary lamina, and the internal medullary lamina. The stratum zonale is a thin layer of white matter that covers the superior surface of thalamus. The external medullary lamina, as mentioned before, covers the lateral surface of the thalamus. The internal medullary lamina, on the other hand, is Y-shaped white matter and divides the thalamus into three nuclear groups. In the figure, we can see that the internal medullary lamina is a Y-shaped white matter, and it divides the thalamus into three nuclear groups. They are the anterior group, the medial group, as well as the lateral group. Coming to the grey matter of thalamus. As mentioned before, the internal medullary lamina divides the thalamus into three nuclear groups. They are the anterior, the medial, as well as the lateral. Anterior nuclear group contains mainly a single nucleus, which is known as the anterior nucleus. The medial group also contains a single nucleus known as the medial dorsal nucleus. The lateral group of nucleus is divided into two groups: a dorsal group which forms the upper level or the upper tier of nucleus, and the ventral group which is located below the dorsal group and forms the lower level or the lower tier. The dorsal group is again divided into three. They are the lateral dorsal nucleus, the lateral posterior nucleus, and the most posterior is the pulvinar. The ventral group, which form the lower tier of nucleus, is divided into three. They are the ventral anterior nucleus, the ventral lateral nucleus, and the ventral posterior nucleus. The ventral posterior is again divided into two. The nuclei that lies medial is known as the ventral posteromedial nucleus, and the nucleus that lies lateral is known as the ventral posterolateral nucleus. In the diagram, we can see that the thalamus is divided by a Y-shaped internal medullary lamina into three nuclear groups: the anterior nuclear group, the medial nuclear group, and the lateral nuclear group. The anterior nuclear group contains a single nucleus known as the anterior nucleus. The medial group mainly contains a single nucleus known as the medial dorsal nucleus. The lateral group is divided into two levels. The upper level is known as the dorsal group, and the lower level is known as the ventral group. The upper level or the dorsal group contains three nucleus. We have the lateral dorsal nucleus, the lateral posterior nucleus, and the pulvinar. The lower group or the ventral group contains three nucleus, that is the ventral anterior nucleus, the ventral lateral nucleus, and the ventral posterior nucleus. The ventral posterior is again divided into two. The nucleus that lies medial is known as the ventral posteromedial nucleus, and the nucleus that lies lateral is known as the ventral posterior lateral nucleus. Coming to the connections of each nuclear group. First is the anterior group. The anterior group contains a single nucleus known as the anterior nucleus. It is mainly limbic in function, and it is part of the Papez circuit. The afferents to the anterior nucleus comes from the mammillary bodies through the mammillothalamic tract. The efferent goes to the cingulate gyrus through the anterior thalamic radiations. The medial group. It has a role in emotions and personality. The afferents to the medial dorsal nucleus comes from three structures. They are the amygdaloid nucleus, the olfactory cortex, and the globus pallidus. The efferents from the medial dorsal nucleus goes to the prefrontal cortex. The prefrontal cortex is the part of the brain that is concerned with emotion and personality. The lateral group, as mentioned before, is divided into two groups: an upper group, which is known as the dorsal group, and the lower levels of nuclei known as the ventral group. Coming to the dorsal group, the lateral dorsal and the lateral posterior nucleus will receive afferent from other thalamic nuclei. The efferents from the lateral dorsal nucleus will reach the limbic lobe, whereas the efferents from the lateral posterior nucleus will reach the superior parietal lobule. The afferents from the pulvinar comes from the LGB or the lateral geniculate body and the MGV or the medial geniculate body. The efferents will go to the parietal and the occipital lobe. Coming to the ventral group. The ventral group contains the ventral anterior, ventral lateral, and the ventral posterior. The ventral anterior receives afferents from the globus pallidus and the substantia nigra, which are part of the basal ganglia. The efferents from the ventral anterior reaches the premotor area. The afferents from the ventral lateral nucleus comes from the dentate nucleus. The efferents from the ventral lateral nucleus reaches the primary motor area. Now we have the ventral posterior nucleus. The ventral posterior nucleus, as mentioned before, has two parts: the ventral posteromedial nucleus and the ventral posterolateral nucleus. The ventral posteromedial nucleus will carry all sensation from the head region. The general sensation like the touch, pain, temperature, etc. are carried by the divisions of the trigeminal nerve and reaches the thalamus through the trigeminothalamic tract. The sensation of taste from the tongue are carried by three nerves. From the anterior two-third, it is carried by the cauda tympani branch of facial nerve. From the posterior one-third by the glossopharyngeal, and the posterior most by the vagus. These fibers reaches the nucleus of tractus solitarius, and from the nucleus of tractus solitarius, the sensation reaches the thalamus by the solitariothalamic tract. The ventral posterolateral nucleus will receive all sensation from the limbs and the trunk. These are carried by the medial lemniscus and the spinothalamic tract. The medial lemniscus is the continuation of the dorsal column pathway, carrying sensations like fine touch, vibration, proprioception, tactile localization and discrimination, etc. Whereas the spinothalamic tract carries the pain, temperature, crude touch, etc. Different from the ventral posterior nucleus will reach the somatosensory area located in the postcentral gyrus. This area is represented by Brodmann number 312. Coming to the thalamic radiations. The thalamic radiations are the efferent fibers of the thalamus. The efferent fibers of the thalamus reaches the various regions of the cortex by forming four bundles. They are the anterior thalamic radiation, the superior thalamic radiation, the posterior thalamic radiation, and the inferior thalamic radiation. The anterior thalamic radiation reaches the cortex through the anterior limb of internal capsule. The superior thalamic radiation reaches the cortex through the posterior limb of internal capsule. Posterior radiation passes through the retrolentiform part, and the inferior radiation passes through the sublentiform part of internal capsule. The anterior thalamic radiation reaches the prefrontal cortex. The superior radiation reaches the sensory and motor areas of the cortex. The posterior radiation reaches the occipital lobe, mainly to the primary visual area. The optic radiations, which are part of the optic pathway, passes through the posterior radiation. The inferior radiation reaches the temporal lobe, mainly the primary auditory area. The auditory radiations, which are part of the auditory pathway, are passing through the inferior radiations. Coming to the arterial supply of thalamus. The thalamus is mainly supplied by the perforating branches of posterior cerebral artery. The thalamus is also supplied by small branches from other arteries. The perforating branches of posterior cerebral artery is again divided into two main groups, the posteromedial branches and the posterolateral branches. The posteromedial branches is also known as the thalamo-perforating branch. The posterolateral branch is also known as the thalamo-geniculate branch. The posteromedial branch will supply the medial as well as the anterior part of thalamus, and the posterolateral branch or the thalamo-geniculate branch is supplying the lateral and the posterior part of thalamus. Coming to the clinical correlation, we have the thalamic syndrome of Dejerine-Roussy. The thalamic syndrome occurs when there is a vascular occlusion to the thalamo-geniculate branch of posterior cerebral artery. As we have mentioned before, the thalamo-geniculate branch of posterior cerebral artery is supplying the lateral as well as the posterior part of thalamus. The clinical manifestation of thalamic syndrome are contralateral sensory loss. This is due to the involvement of the ventral posterior nucleus. We have discussed before that the ventral posterior nucleus have two parts, the ventral posterolateral and the ventral posteromedial. These two nuclei receive all sensation from the entire body. Hence, the sensory supply from the contralateral part of the body is lost due to the involvement of the ventral posterior nucleus. Then we have the thalamic pain. The thalamic pain is the severe, persistent, episodic and intolerable pain seen in patients with the thalamic syndrome. The thalamic pain can be precipitated by stimuli such as light as well. Then we have the thalamic hand. The thalamic hand is an abnormal posture seen in people with thalamic lesions. Lastly, we have the homonymous hemianopia. Homonymous hemianopia is due to the involvement of the lateral geniculate body.